One committee is returning back from recess on this. Senator Whitehouse is recognized for questions.
Thank you, Chairman. Mr. Secretary, I want to talk to you about Rhode Island. When you were last sitting there, here's what I said to you. I want to read it back to you because I want it to sink in. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers, a difference of 23 and 26% in our regional healthcare market. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act that CMS took on this issue years ago was to make it worse. I raised that with you then. I've raised it since with Dr. Oz. I've raised it with CMMI Director Sutton. I would like to get action from CMS on that. One partial avenue of relief for Rhode Island is the AHEAD program. Rhode Island is a willing voluntary participant in the AHEAD program.
Hey everyone, welcome back to the channel. If you're new here, I'm your independent political analyst, no spin, no tribalism, just facts, context, and thoughtful commentary. Today, we're looking at a Senate exchange where Senator Sheldon Whitehouse Press Health and Human Services Secretary Robert F. Kennedy Jr. over Rhode Island's healthcare reimbursement rates. This is a pretty technical policy fight, but it speaks volumes about how federal healthcare decisions ripple down to states and affect real people.
Coming behind Rhode Island is Connecticut. What remains to be seen is whether the payment rates agreed to for Rhode Island will suffer the same discriminatory discount with respect to the AHEAD rates for Connecticut as Connecticut comes through. I've been able to get no assurances from CMS that they care one whit about this payment differential or that they see AHEAD as a means of resolving this injustice. Mr. Kennedy, our healthcare system is teetering as a result of this. This is not a casual matter, and I would really like to see you and Dr. Oz and Mr. Dutton put your attention onto this Rhode Island problem. There is no conceivable justification for paying a hospital in Fall River 23% more than Rhode Island Hospital when Rhode Island Hospital provides more and better services, as recognized by the Secret Service, which will take an injured president from Martha's Vineyard to the Rhode Island Hospital Trauma Center, flying right over St. Anne's Hospital in Fall River, yet Fall River gets paid more. It makes no sense, and it has to be resolved. The other problem that I mentioned to you is that I'm now in my 4th round of CMMI directors. It's bloody Groundhog Day, trying to get something done about how end-of-life patients are treated. I'm offering Rhode Island as a willing example of how we can do it better. It is idiotic and cruel to force a family to put their dying loved one through 3 days and 2 nights of a hospital before they can put them in a nursing home. It is equally ridiculous to not allow palliative and curative care to happen together. Providing home care when someone is dying, even if they can still get out of the house or into the yard, is a basic thing to ask. And to have respite care be that somebody comes to the house instead of taking a dying family member to a hospital, that's not even respite. Every single one, Mr. Kennedy, of these waivers has been granted in the past by CMMS and other circumstances. All I want is for somebody to come and work out how we do this in Rhode Island. What is our patient base that we'll do this in, how we put the waivers together. To quote your CMS director, Mr. Oz, he said, as we discussed in your office, we must re-examine how end-of-life care is addressed in this country. I'm offering Rhode Island as an example of how to make it better. I hope you will concede that right now it is not good. So
Senator,
I need you to respond to me. You guys know where to find me. I'm up in the Hart Building.
Yeah.
We've reached out, we've tried for meetings, and the progress in all 3 of those areas, fixing the payment gap, getting ahead balanced regionally and following through on our desire to do good things, improving end-of-life care with waivers you guys have already granted, has gotten me so far no place. And forgive my impatience, a lot of it predates you. I put a hold on Biden nominees because I was getting jerked around by your bureaucracy. I'd like it to end and get some progress.
Yeah, you know, Senator, you raised this during my confirmation hearing, and I said to you then, and you were very civil. You raised something that makes a lot of sense to the extent that we have the power to fix it at CMS. I'd like to do it. We've had the same kind of complaints from Vermont. But I said to you at that time, call me and let's come talk about this. You have my cell phone. You can call me anytime. I've never heard from you in 7 months. Call me up. I'd love to meet with you. I'll get Oz in the meeting. And, what you're saying, particularly about at the end of life, it may be something we can do something about. I want to help, and, let me know.
We'll try. Forgive my frustration. You've got 30,000 employees. They could have reached out to me. They know where I live.
Yes.
Let's start with the central issue. For years, the Centers for Medicare and Medicaid Services, or CMS, has reimbursed Rhode Island providers at significantly lower rates than providers in Massachusetts and Connecticut. Senator Whitehouse says the difference is about 23 to 26%. In practice, that means a Rhode Island hospital performing the exact same service as a Massachusetts hospital gets paid far less. Whitehouse argues this funding gap has bled Rhode Island's healthcare system dry. He calls it unjustifiable, especially since Rhode Island facilities often provide better services. As an example, he noted that the Secret Service prefers Rhode Island Hospital for presidential emergencies over nearby Fall River, Massachusetts. Yet Fall River gets reimbursed at a higher rate. His point was clear. This makes no sense and undermines Rhode Island's system. One possible solution on the table is the AHEAD program, a federal initiative designed to reshape healthcare delivery and payment models. Rhode Island was an early volunteer to participate, but Whitehouse worries that when Connecticut joins, it will once again receive better rates, leaving Rhode Island stuck at a disadvantage. So far, CMS hasn't given him reassurance that this won't happen. Whitehouse also pushed hard on another issue, end-of-life care. He described the current policies as idiotic and cruel. Families often must put dying loved ones through unnecessary hospital stays before qualifying for nursing home care, and they can't always access both palliative and curative care together. Whitehouse argued for common-sense reforms like allowing care home or making respite care mean in-home support instead of another hospital trip. According to him, CMS has granted waivers for similar changes in the past, and Rhode Island is offering itself as a test case. But after years of raising this issue with multiple CMS directors, Whitehouse says he's hit a wall of bureaucracy. Out of frustration, he even admitted to putting holds on Biden administration nominees to get attention on this problem. Now, when it was Kennedy's turn to respond, he didn't dismiss the concerns. He acknowledged that Rhode Island's case made sense, and even said he's heard similar complaints from Vermont. Kennedy urged Whitehouse to call him directly. He pointed out that the senator has his cell phone number and said he's willing to bring in his top staff for a meeting. But Whitehouse pushed back, saying that with 30,000 employees at HHS, someone should have already reached out proactively. His frustration was clear. So, what should we take away from this? On one hand, Whitehouse has a strong argument. Payment disparities like these can devastate a state's healthcare system, especially in smaller states like Rhode Island. Hospitals and providers need fair reimbursement to survive, attract staff, and maintain services. On the other hand, Kennedy is highlighting an important truth. Fixing CMS payment systems is complicated. They're tied to formulas, legislation, and national frameworks that don't turn on a dime. Even when a problem seems obvious, it can take years to adjust. As for end-of-life care, this is an area where both policy and humanity collide. Whitehouse is giving voice to frustrations many families share. Rigid rules that force unnecessary suffering. And Kennedy's willingness to engage could open a door, but whether bureaucracy can actually deliver change is the bigger question. In the end, this hearing underscores two things. First, that federal healthcare funding formulas can deeply disadvantage some states. And second, that even when both sides agree on a problem, breaking through bureaucracy remains a massive hurdle. So, what do you think? Should RFK Jr. and CMS overhaul these payment formulas to level the playing field? And do you agree with Senator Whitehouse that end-of-life care rules are outdated and inhumane? Let me know in the comments. I'd love to hear your thoughts. Thanks for tuning in, and as always, I'll see you in the next one.